What is, again, another definitional issue here. The difference between an episodic and chronic migraine. How do we parse that out? Anybody want to jump on that?
The difference is pretty arbitrary, I believe. The dividing line is whether or not a person has more or less than 15 headache days per month, not migraine days, headache days. And for someone who has chronic migraine, they're experiencing 15 or more headache days per month and 8 migraine days per month.
I just want to stop for a moment and drill into those numbers, okay? 15 headache days per month, with the exception of February and some of the 31s, that's approximately half of your life.
Yeah.
Right? So that's a lot.
It's
and then
a
it goes
lot.
up from there.
Yes.
This is a disabling, horrible problem.
Yes.
And I'm not sure a lot of clinicians get that. They see a patient who comes in, I've got a migraine. Yeah, but you've got it half your life.
Right.
And it's disabling. So how many of these patients are undiagnosed? It would strike me that if it's that bad, that often, you can't have a lot of undiagnosed folks out there.
I think the studies I've seen have said about half or so are undiagnosed. Half are going around with this pain, with this suffering, and no name to put to it, no understanding of it.
Why am I simply, and I'm rarely speechless when you've got half the people who are sick, half the days of the month, with pain which is disabling, but they're not diagnosed, they're not seeing doctors. Why don't they come to our attention?
Yeah, I think there's stigma around pain, there's stigma around chronic pain. I think there's confusion, so lack of education in terms of what this is, and I think it can be mistaken for other situations, sinusitis I think you mentioned. So I think there's a lot of reasons people don't come in and get diagnosed and don't get treated,
All I know
unfortunately.
is if I had a bad sinus headache 15 days a month, every month, I'd probably come see you.
It might, but it might seem odd, but people who have something all the time begin to think it's normal. Many patients I see will talk about their bad days, and if you drill down on it, they more or less are never normal, but they regard their not so bad days as normal days. Imagine that you live in a family where mum and dad had headache, and you've got headache, and brothers and sisters have got, and actually everyone around you's got headache. You might get the idea that's pretty much normal. And while that might sound crazy, I think there's an element of this living with normality. Migraine patients do an incredible job at doing the best they can when they're given all the disability, because they kind of learn to get on with it. And it just surprises me sometimes how much they can get done given how much they're disabled by.
But there's a tremendous economic burden.
Right, I was going to say not everybody, right? So not everybody's able to function at that
No,
high
I
level.
wouldn't suggest everybody, but I think it explains the some part of the very large proportion of people who don't get diagnosed or don't get managed. They kind of just get used to it in a very and they operate at a lower level, and their life is never what it could be.
I mean, just from an economic standpoint, there's got to be a loss of productivity here, and employers have got to see this as a tremendous burden.
I think it's one of the main reasons people miss work, and they say absenteeism and presenteeism as well. So people who are actually at work but not functioning, where they could be. So huge issue for employers and, obviously for the migraine sufferers themselves, because they can't participate.
It brings us to you, right? The patient advocate.
Right. So I have a friend who has to work, and she has a bed in the back of her car that she goes to at lunchtime, takes a break, takes a nap, tries to recover from her morning, and then goes back in and goes to work.
What about the folks who come in complaining of headaches and get misdiagnosed? How often does that happen?
I'm not certain how often that happens, but I do know from anecdotal experience that there are people that go to their physicians and they pat them on the hand and they say, oh dear, it's just stress. Or, gosh, your breasts are so large, I think you need a breast reduction. Or, have you tried meditation and chamomile tea? But that's not always the case.
What about the comorbidities here? We're not talking just about pain, right? What else is there that patients have to deal with?
So, typically with sleep disorders, anxiety problems, depression problems, obesity is a comorbidity, asthma is a comorbidity. it's quite extraordinary actually, the burden. There's the burden on the patient, and then as you were saying about the economics, the estimates are that the burden on the US economy is north of $20 billion a year.
That's with a B. Those are federal numbers.
That's
there.
federal numbers, yeah.
That's big. But I don't want to make light of it. That's a tremendous expense.
Very expensive.
I'm curious as to why we don't recognize what a tremendous expense this is and why we're not mobilizing more resources. And then I want to move on. But somebody help me on this one. Anybody know?
Well, there's as you mentioned, there's a big stigma surrounding many headache disorders, and as Dr. Goadsby said, people push through. In the migraine community, we refer to our pain in levels 1 to 10, as most physicians do. And if you have a level 4, you can pretty much push through and go through with your day. But other than that, it's a problem.
All right, well, let's
I've got to add that diseases get of their time. There was a time when people with epilepsy were considered as possessed and burned at the stake. It's well known that's a thing. EEG, for example, electroencephalography, brain testing, probably rehabilitated a bunch of epilepsy. Not just that, but and I don't mean to trivialise epilepsy in any way, but diseases come of their age, and migraine has been a little in the sort of Cinderella, under-recognised, difficult to plug, and maybe tricky in diagnosis. It's evolving, and we're living the dream. We're living the dream of understanding. We're getting some idea about the genetics. We've got brain functional imaging to show us things are actually happening. At last, we're developing new therapies that are specific for the condition. I think I don't want to be too critical of doctors because I think it's been difficult. I think it's getting better. And now's an opportunity to grasp these improvements